real conversations, and some hard truths. Gangs, drugs, and guns. Giving a voice to those willing to sacrifice. We have stories that need to be told. We have lessons that need to be taught. Protect and serve. Welcome to The Quiet Professional. Hey everybody, welcome back. Nathan Romas with you. Today we have some big topics here. We're going to be talking about the Royal Canadian Mounted Police Longitudinal PTSD study, as well as the National Police Federation's study on member mental health. For that, I have two returning guests. First one is the president of the National Police Federation, Brian Sauve. So welcome back, Brian.
Thanks for having us back.
And the other one is a returning guest we haven't had on since 2022, as we were saying off air. So it'd be Dr. Nicholas Carleton. And Dr. Carleton is a professor of clinical psychology and registered doctoral clinical psychologist in Saskatchewan, and serves as the scientific director for the Canadian Institute for Public Safety Research and Treatment, or CIPSRT, as some people may know the shorthand. So welcome back, Dr. Carleton.
Thank you. I'm delighted to be back.
So we got some big things going on for member mental health. It's great to have you both on, and you're both continuing your work in this area. It's definitely a growing topic, a growing area, I'd say, of concern, but at least we have some smart people working on this and looking for some solutions. So if maybe one or both of you want to kind of jump in on this, but if we can just give the listeners, maybe ones who haven't heard the first episode, we did Dr. Carleton on the longitudinal study specifically, but if you could tell us what was the longitudinal study, a short summary of it, and also the NPF's study, and kind of what do both focus on and what's the intended outcome?
Sure. So the longitudinal study, really the genesis of that was back in 2016, 2017, where we had early research results that were indicating that the RCMP serving members were having some pretty substantial challenges with mental health. And part of the steps that were undertaken at the time to address those challenges involved recognizing that we were missing a lot of the really most powerful research information that we would need in order to effect really long-standing changes to protect RCMP mental health ongoing. And so in 2018, we published the very first, to my knowledge, the very first national sample of RCMP data with respect to where RCMP serving member mental health was at. And it was nearly 1 in 2 who screened positive at the time for one or more mental health disorders, which is much larger than the diagnostic rate we would see in the general population at any given time, which is 1 in 10.
Okay.
And part of the RCMP deciding to address that was them saying, what would a really Cadillac-style solution to this look like? And there was a large team of us that came together and said, well, we need to engage in longitudinal assessments and longitudinal interventions. So we can't do a small study to tackle this down. We need a lot of data over a long period of time in order to tackle this down. And what we can do is build tools and training that are informed by the best available evidence that can then help us to provide proactive protections for member mental health. And hopefully, if we roll that out broadly enough, and if we learn as we're rolling that out to the best of our abilities, how most effectively to proceed, that can start to bend that curve if we roll it out really large scale. But it'll take several years for us to get there, and there's a lot of steps between where we are and where we need to be. So that was around 2018. More recently, thanks to the National Police Federation, their investment in doing the NPF study allowed us to check where RCMP serving member mental health is at right now. And the results that we've got suggest that we've gone from about 50% in 2018 to about 65% today. So that's a pretty big jump. At the same time, the longitudinal study has been making a lot of progress in developing tools and training that we believe we're starting to get the early results now, because longitudinal studies, the problem with longitudinal studies is built right into the name. They're long.
Yeah.
So we're getting those results out, and we're now getting to a point where we can make better and better informed recommendations for the NPF and the RCMP. But the NPF study is very aptly timed because it's showcased that our members across the country are facing some pretty substantial and growing challenges.
Yeah, and I think especially with the timing thing, I mean, we just had COVID, BLM, George Floyd, protests for basically every topic under the sun are up. So yeah, it's definitely a difficult time in law enforcement. So it is, I mean, it's nice that somebody's looking out for all these things. One of the things I was going to pick up on was with the longitudinal study, I guess, maybe even the NPF one, but the longitudinal, has anybody done anything like this in law enforcement or even any other kind of sectors or industries? Do we have any kind of examples to look at or piggyback off of?
There's lots of examples of groups that have done various pieces of what we're doing with the longitudinal study. But the breadth and depth of the longitudinal study, I haven't seen anything like that before. So there's people that have done snippet pieces in our military, and some of the US and the UK team members have done pieces of this puzzle. But to our knowledge, this is the very first time that somebody has tried to essentially tie a bunch of the pieces together and deliver them as one unified solution. And so we're pretty sure that this is still historically unprecedented in size, scope, breadth, and depth.
Yeah.
And that has a lot of pros that go along with it. The biggest con is that when you're doing those big things, it requires time and patience in order to really see all the benefits. But we are already seeing early results, and they're posted on the website. So one of the early results that we've been able to make available that I think is a really powerful message for people to remember is that the RCMP cadets are starting with better mental health than the general population.
Yeah.
So they're starting with better mental health than the general population. But thanks to the NPF, we now have results that demonstrate the serving members have much worse mental health than the general population. This addresses an important, or helps to address an important 150-year-old argument, which is the problem is we need to hire people that have better mental health, and then we won't have mental health problems among the serving members.
Oh.
It's not true. And if you'd asked any police officer, they would have told you, well, that doesn't make sense to me. But now we have that independent evidence that really underscores the problem isn't with who we're hiring. The problem is with what we are asking them to do after we've deployed them, while they are serving the rest of us, and the kinds of supports that are available to help protect them while they're protecting everybody else.
Yeah, and I think that tracks obviously with the type of recruiting that law enforcement does, right? And I remember going through the RCMP process. I mean, you're going through several steps. Some of them are pretty rigorous and get very in-depth in your personal background and your history. So we're recruiting people. When we're recruiting, we're looking for those types, right? The mentally strong. But at some point throughout the career, once they're in, there's like a big shift. When we're talking about the results, I mean, we'll kind of get into that here. As you know, do we see? Are we looking for this, or has there already been found? I guess a point at which you see someone goes from that shiny new recruit, everything's great, to what we're seeing today, where some of these results, and maybe Brian could kind of speak to the numbers, they are shocking. Like super shocking. I actually didn't realize, like when I was looking at the numbers, the percentages, they are mind blowing to say the least. So is there a point at which we can kind of see the shift at all, or is it just everything's going to be dependent?
I like to be lighthearted, but I could say it's usually after the first divorce. No,
Yeah.
I don't know, right? The interesting thing about the study that we commissioned for a point in time with Dr. Carleton, obviously you're dealing with serving members who are most probably not part of the longitudinal study. The majority of them are probably not, right? So you're talking 5 to 35 years service. But I have to give credit to, sometimes the RCMP gets thrown under the bus or is considered an archaic organization without the opportunity to move or think forward. But I have to give credit to them for actually embracing the longitudinal study and continuing to fund it, because obviously it's going to have impacts far and wide, whether it's the Toronto Police Service or even the Scottish Police Service or the UK, and because ultimately they're doing something that's unprecedented. And then for us, obviously we're the union, so getting that snapshot of a point in time in 2022-23 compared to and the 2017-18 public safety personnel study and the comparators, obviously it becomes a bargaining chip for us to be able to lobby with different levels of government to expand the services that are available to our memberships. We're obviously in the midst of collective bargaining now. We'll probably wrap that up early summer, and then how do we prepare ourselves again for the ultimate next round of bargaining, knowing these results are out there and knowing there's issues that need to be resolved or services that can be implemented at a provincial or RCMP speak divisional level that can alleviate a lot of the challenges our members face, like isolated posts, limited access to cell service, bandwidth coverage for internet, no psychologists, social workers, therapists available in person in a community, needing a flight out to go and see someone. So can we come up with outside the box solutions that exist in 2024, leveraging 2024, 2025 technology that can plug some of these gaps until we can get to a point where we realize just what you said. Where does it fall off the rails?
Yeah.
Throughout someone's service, right? If we can have a healthy workforce going into depot, graduating from depot, and then there's a lot of internal mechanisms and support systems in place to maintain the resilience or to stop the erosion of resilience that allows the infiltration of numerous exposures to have a greater impact on someone's mental health, then it's going to take a while.
Yeah.
I think Nick he's probably good for another decade with us at least.
Well, I think too is like, at least even if it takes some time to come up with what we call, like, I guess, the solutions, at least maybe for some people, they're thinking someone's looking at this and there is light at the end of the tunnel. There is hope, because that's what keeps people going, right? Is having that hope. One of the results that I mean, I would be bringing this up with ministers or whoever I'm lobbying. It is so that it's under a table here. It's called, in the results, it's called, the RCMP members have a higher prevalence of suicidal behaviors. The 2023 RCMP sample was 34.1% had contemplated suicide at some point in their lifetime. So, I mean, even if we're not talking about people that are involved in the longitudinal study, but this is asking of people in general in the RCMP if they've contemplated it. Am I correct on that? And so 34%, I was like, holy shit. That was a holy shit moment where I'm thinking, you look at like an average platoon or squad or whatever they're called now, you have like 7 or 8 people, maybe. It could be as high as 12 or 13. So 2 other people on that squad with you have contemplated suicide at some point in their life. I just thought that was insane. Like, what a statistic to bring up. So when we're talking about, like, how do we prevent this, and as Nick kind of put it, we're protecting mental health, have we found anything to maybe on the preventative side that works so far? Is there anything that can kind of prevent that? But also for the people that are in that 34%, how do you kind of bring them back into, a healthy space?
I guess I'll start by saying that, if we're going to go to a particularly grim perspective on this, the other thing that I would flag is that the 34% is probably an underestimation. The
Yes.
reason that it's an underestimation is that anybody who died by suicide didn't have the opportunity to participate in the study.
Yeah. And then there was also, in the bigger part of the report, I think you also note that anybody that's on sort of stress leave or didn't want to take part in the study for whatever reason, whether the questions kind of trigger certain things. So yes, it definitely is an understatement.
Yeah. And as for prevention, well, getting ahead of prevention for suicide has been something that has been a challenge for a lot of different populations for a very long time. When we think about prevention, I think it's important to really focus, particularly here, on the idea that there's not likely to be one single thing. There's not one magic thing that we're going to be able to do that will resolve these challenges. It's actually a host of things that create the risk and a host of things then that can mitigate it. So some of it is certainly the exposure to some of the really, really challenging things that RCMP members need to engage with as part of their vocation. But some of it is also other stressors, the organizational and operational stressors that go above and beyond the exposures to potentially psychologically traumatic events. I can't stop, and I don't know how we ever would stop, for example, the need to have an RCMP officer at a motor vehicle accident. We can't stop the motor vehicle accident. But perhaps what we could do is address some of the other challenges that we know are associated with mental health, like resourcing shortages, rotation challenges. These are some of the levers, for example, that we've seen other agencies pull in order to try and manage their mental health challenges. If we can manage those mental health challenges, broadly speaking, then that should hopefully help to reduce the challenges specifically related to suicide. As for how to get it down, I mean, once somebody's had the suicidal ideation, of course, we can't go back in time and stop that from happening. But what we can do is give them more hope and provide more supports so that an ideation remains an ideation and doesn't shift to become a plan and then doesn't shift to become an attempt.
Yeah.
And I think that's really what we're after.
Mhm.
Part of that is staying on top of mental health. It's Part of it is staying on top of it. So the RCMP longitudinal study, one of the things that it does is it gives people the opportunity to regularly check and monitor their own mental health. And you can then start to treat mental health more like dental health
Mhm.
or more like physical health. If you wait and so if I feel a little ouch in my mouth right now and I go and see the dentist right now, it's much easier for the dentist to try and navigate that little tiny starter cavity than if we wait until I've got a massive gangrenous sore in my mouth and all of a sudden I need orthodontic surgery, right?
Yeah.
It's been challenging though for us to treat mental health like dental health. And part of the tool sets that we've built allow our CMP officers to have a better opportunity to go, you know what? My symptoms have started to get a little worse. I've noticed some changes. My mood is just not getting up lately. I'm more anxious. I'm more frustrated. Okay, well, we can then flag for them early on and say, you know what, you're starting to have trouble. Let's get ahead of this situation and get you some support right now. That's a real action-based solution at the individual level. We also need those big structural solutions to happen at the systems level, and that's where I think we need more help from Brian to figure out what's possible there. But it's got to be that combination of solutions, Nathan. It's never going to be a single thing. We need a bunch of things all at once.
Yeah. One of the things that I guess a specific term I kind of wanted to ask about that was in in the results of the study was suicidal behavior. So you have a part in here where it says inadequate mental health supports are there's a higher prevalence of mental health disorder associated with that and suicidal behavior. So when we're talking about actual behavior, when I read that, to me that means attempts, maybe planning. Is that the same definition? Is that the intended definition of that? Like we're talking about someone's actually not just thinking about it anymore. Now I've taken some step, whether that's planning or actually attempted. Can you kind of explain that a bit more?
Sure. When we use suicidal behaviors, we do include ideation, planning, and attempts all under that larger umbrella. Part of the reason that we do that, though, is because it's not sort of they're not real clear divides between some of those pieces, right? So if I imagine if I have suicidal ideation, most of us have. I shouldn't say most of us. If I have suicidal ideation, I'm probably not going, boy, I wish I was dead, and stopping there. I would go, boy, I wish I was dead, and then you might have a fleeting thought about how that might happen that is appended to it. You haven't got a plan, so to speak, at that point, but ideation shifting into plans. Well, there's also a variety of different kinds of planning, right? There's a spectrum there. So there's plans like maybe I'll jump off of a tall building. Well, okay, that's a fleeting plan as part of a thought, and that's arguably a bit different. For example, then I'm going to go and climb on top of this building on this day, and I'm going to jump off in this way. Now I know
Okay.
for sure I can do it, and I've turned around and I've got my affairs in order. So this is part of why it's sort of a spectrum. And when we say suicidal behaviors, we try and use it to include the whole spectrum at once when we're referring to things.
Okay. Yeah, it makes sense. I think just for everybody, like they could all have just a different definition when they're reading the same word. So it's good to get the clarification. Um, Maybe, and just before, I want to get to asking Brian about some of the lobbying side of things and
Yep.
who exactly you talk to get this rolling. But um, what type of, can you talk about the type of questions that were on the NPF survey? Like, can you explain what exactly is being asked of people and what exactly the structure of the survey looks like?
Well, yeah, that one's best to Dr. Nick. It's been 2 years since I looked at the original draft
Okay.
of the questions, but from a results perspective, obviously, the longitudinal study will carry on great, and we will be an advocate for the continued funding and resourcing of that study as it carries out. So, from a lobbying, I think I'm a registered lobbyist in just about every province and territory in Canada, as well as federally. So, with the way we launched the NPF study and the results that came out of that, whether you're talking about suicidal ideation or alcohol abuse or the potentially psychological traumatic incidents and the incidents of PTSD on the rise and all of that stuff, was through a parliamentary breakfast. Right. So we hosted and sent out invites to, I think there were about 70-ish, mixture of parliamentarians, academics, parliamentary staff, parliamentary secretaries, brass from the RCMP. We had the commissioner and three deputy commissioners there. Minister of Public Safety was there with his parliamentary secretary. The Minister of Mental Health and Addictions was there with her parliamentary secretary, as well as a few senators and such. So, and we actually did quite good. There were 8 other parliamentary breakfasts happening that same day at that same time. So we actually got, I think, almost a quarter of the House of Commons. So I think we did fairly good there with respective ministers. But then post that, obviously, I've talked to the commissioner since then about the recommendations, and you'll see in the recommendations, we're not asking for anything really that costs money, right? It's tick a box or approve this or approve that. So I've talked with the commissioner about different things. We'll talk to our occupational health and safety branch within the RCMP about different levels of approvals for treatment and care. And I had the opportunity. I mean, I see the Minister LeBlanc of Public Safety regularly, just in passing in Ottawa. But last week we happened to be staying in the same hotel in Ottawa, so we rode the elevator, from a true elevator pitch, from the 16th floor all the way down outside. And obviously he has a ministerial protection package, so they're members of the NPF that actually protect him and drive him around. So got the opportunity to chat with him, and again thanked him for his attendance at the breakfast and about how we can move this forward to come to a positive resolution for a whole bunch of folks. So yeah, lots of lobbying. We're looking at the PSP Net program through CIPSRT, and how the NPF can help CIPSRT and other agencies actually make it a national program available to all public safety personnel across the country. Again, it comes down to funding and how the provinces want to engage in that, keeping in mind that the program's been proven extremely successful. And ultimately, if a member of the Vancouver Police Department or even the BC Sheriffs or BC Corrections is having challenges with their mental health, would they not be wise to invest some money in PSPNet so that those employees, those members, can have access to that service and care and lead a more happy, healthy life? reduced absenteeism, reduced recidivism, and all sorts of things. So it's putting a little money in the forefront so you don't have it at the back end. Kind of like changing your oil regularly in your car, right?
Hmm.
Do it regularly and it'll last longer versus waiting for it to blow up.
Yeah, have one giant problem. Um,
Mhm.
Maybe I'll jump to Nick and ask the earlier question because I'm going to come back to you, Brian, and we'll get into is it more on the lobbying because I want to ask if people
Yep.
really get this and how much lobbying you have to do, and just some of the different groups you had talked about earlier, so municipalities and things that you'd were mentioning off air that you actually talked to, which I never would have guessed was a part of this. So if I could jump to you, Nick, and we'll just ask about that study, the NPF side of things. What type of questions are people asked, and you know how do you kind of elicit a response out of people that I want to say one maybe isn't embellished on some side of things because one of my gripes is always people who kind of abuse systems for others. But how do you know? How do you get a proper response from people and they're not reading the same sentence two, three, 1,000 different ways? So, what kind of questions are on this?
Those are really smart questions. So, okay, so let's do that. Let's break those into chunks, though. So, first of all, what kinds of questions? We ask questions about a lot of different things. We ask questions about several symptoms that are associated with different mental health disorders. So, PTSD is one that people commonly think of, but there's also major depressive disorder, panic disorder, generalized anxiety disorder. There's a host of challenges that people can experience, and so we ask questions that assess where those symptoms are at, and we get people to sort of give us an idea. How often do you experience this? Do you experience this a little? Do you experience this a lot? And in doing so, excuse me, in doing so, we get a handle on what they're reporting those symptoms look like. The tools that we're using are really broadly standardized tools. So those questions are questions that have been checked and rechecked hundreds of times and thousands probably of times. And they're very broadly used internationally tools. Those are the ones that we select so that we've
Okay.
got good normal data to compare against. It's also it's been our experience so far that if anything, people are more likely, even in these kinds of surveys, to underreport their symptoms and to be more likely to go, yeah, maybe I really don't feel that way all of that often. You've also got checks and balances that go into these sorts of things. We've got ways statistically that we can check for things like random responding. And so there's programmatic ways we can check. In my experience, though, for the most part, I think it's very uncommon that people will inflate their symptoms in ways that don't sort of just become they tick the yes box on the far right hand side the entire way without looking.
Yeah.
So by assessing all of those, we also assessed a variety of other different kinds of stressors so that we could get a handle on not just the symptoms that they're having, but what kinds of stressors are they experiencing and how frequently are they experiencing those stressors. And I think it's important to flag those because I don't think the general population really appreciates just how much stress our RCMP are under. So somebody like myself would be exposed to 5 or fewer potentially psychologically traumatic events in my entire life. That's just the population norm. But as I'm sure you both know, that could be a shift. Like that could be a single day for an RCMP officer, not
Yeah.
not lifetime. But in addition to those, there's a host of different occupational stressors that we assessed for. So, do you feel like you've got enough resources? Do you feel like you've got do you feel like you've got these kinds of additional challenges that are impacting you? Do you think you've got enough time to manage work-life balance in any fashion? How often are you limited with respect to access to the social supports that human beings as a whole need? So it was a pretty large questionnaire, and I'm extraordinarily grateful to the over 2,000 members who were willing to step up and try and help us with this project. It's an incredible contribution they've made to everybody else.
Yeah.
So hoping that gives you a bit of an idea without me belaboring the issue and turning it into me reading the questionnaire, which
No,
I think will be pretty.
it's all good.
Yeah, I mean, aside from Dr. Carlson saying, well, question two was, have you considered, I think overall it took participants on average about 90 minutes from from start to finish to
Okay.
complete. So it's fairly thorough, it's fairly in depth, and a lot of them would start, log out, come back, do it in portions and in sections. And it's we had to do, as we advertised it, and we tried to get our members to engage. And I think overall it was something like 2,300 and change that did a portion of it. But then only 1,000, just under 1,400 actually completed the entire thing. And part of that is probably it was probably triggering for some, going through that, because so yeah, many thanks to those who started and also those who took the time to complete it.
I think whenever you ask any kind of survey at work, I see this at ours too. People always joke about this, but I think some members truly do believe it. You get that, like, what do you think of the organization question, or tell us what you think of your bosses type stuff. And people are like, ain't a chance in hell I'm putting anything in there, because they're going to
Mm,
get it somehow or figure me out. So some people will not answer those, just whether it's conspiracy theory stuff or whatever it might be. But you brought up the organizational versus operational stressors, and I know for myself, in my own experience, the operational stuff honestly doesn't really bother me. It's the organizational. That's the one that I think is
yep.
the biggest issue in my own mind. I've had a few other guests on here, like Michael Sugru. He wrote a book about his experiences, operational side of things, where there was stressors, but even within the organization. And I I find the internal stuff is always the worst, because I don't know. I guess I expect better from people I work with, fellow officers or whatever it might be. We should get along more. People shouldn't step on each other, whatever it might be. I expect the bad guys to be the bad guys. So, or I signed up thinking like, okay, I'm going to see certain things, and I've prepared myself in whatever way that looks like to kind of take that in. So on these studies, both the longitudinal one and the NPF one, do you have any results that show, like, is one worse than the other? Are people saying certain things are the worst stressors? Or what does that kind of look like between the two?
We have that data. We haven't finished analyzing that yet, and certainly the NPF, both the longitudinal study and the NPF data set have that data in it. So it takes time to go through the analysis process. But what I can tell you from the data that we have analyzed beforehand is that it looks like about half of the variants, and this is cross-sectional data, so that's important to talk about in just a second, but about half of the variance in those symptoms appears to be associated with the occupational stressors that are not the potentially psychologically traumatic events. So it doesn't surprise me to hear what you're saying, that it's these other things. Like, yes, that's hard for me to deal with, but this is also a huge chunk of the problem. And so I'm hoping we're going to have those results available. I'm hoping by the end of the year. Academics move slow. Unfortunately, you get good work, but it's slow work. The what we're hearing in general is very consistent with your experience. And part of the caveat that we put on this is it becomes a bit of a chicken and an egg situation when you're taking what we call cross-sectional data. And that's the most common data sets that we typically have. So you could argue, for example, and I'm not arguing this either way, I'm just giving you both pieces of the puzzle here. One argument is that the occupational stressors made it that much worse when I was then exposed to one of the potentially psychologically traumatic events, because I was coming in already upset. I was already down a pint when you sent me to go and deal with this.
Okay.
Another argument that gets made is the reverse, which is, well, okay, the psychologically traumatic event that I just got exposed to, I then went and tried to navigate the situation with the occupational stressors, but I was already down a pint. And so this makes it a difficult situation there. The third argument, the one that I think is probably most likely, is that the two interact with each other. If I've got a really good supportive leader on my team, if I feel like my team has my back, if I feel like at least my immediate supervisor and my partner and my immediate team is there and supporting me, and then I have to go and deal with something awful, I think I'm far more likely to be able to navigate that situation than if those things aren't true. If I've got a team that isn't supporting me at all, but you know what, for the most part, life's otherwise not all that stressful, I'm probably going to have an easier time of it than if we start mixing and matching. If I've got a team that doesn't support me at all, and you've sent me to deal with something horrific, now you've got a much more problematic situation.
Yeah, yeah.
I'd agree. Yeah.
So, kind of going back to maybe the lobbying side of things and seeing how we can get some solutions in place. You were mentioning, Brian, talking to some of the ministers. So, this one group that the NPF goes and lobbies. I had asked this off air. Maybe you could say it on air. So, where does the responsibility for the lobbying for members in this realm come from? Because if the RCMP is the one who has to implement the programs, do they not have anybody that goes and talks to the ministers or whoever it might be, or is it all NPF doing the lobbying, trying to get the RCMP to do one thing, trying to get ministers or whatever groups to do another? So where does the responsibility kind of fall?
I would love to say it all falls at the commissioner's feet. Um, and honestly, it does ultimately. But there are differing priorities of the day, right, for the RCMP. And one of the reasons I think that you have still a relatively new union for the membership of the RCMP is that taking care of its members, whether it be from a compensation, a resource levels, a training, any of those perspectives, was probably for about 15 years considered second fiddle. And it wasn't the primary area of concern for whether it's the minister or government of the day or the commissioner and their senior staff of the day. So we're still a relatively new organization, and we're trying a bunch of little things to see what impact we can have on a whole bunch of areas. Like, for example, our members were considerably underpaid up until 2021. We know that graduating out of depot and the same coming out, a brand new member coming to the Edmonton Police Service, right? Do they show up with a brand new truck? Right.
Yeah.
So that's kind of what happens with our members is, so we've implemented a financial literacy program through, Enriched Academy that's available to all of our members to learn about good debt, bad debt, how to buy a mortgage. You're going through a divorce, here's what to know, all of those stepping stones so that we can maybe take away some of those financial stressors, which could have an impact on the erosion of resilience in their work life or even their family life. And obviously, it helps with the family life, which could erode on the resilience of the work life. We've implemented just last year, we started a pilot with telehealth virtual care, right? So our members are now, for the last decade or so, have been part of provincial and territorial healthcare. So either Alberta Health and Wellness or BCMSP or OHIP in Ontario or RAMQ in Quebec, whatever it might be. And as we know, the public healthcare system in Canada can be challenging at times, especially if you're moving provinces and have to wait for a family doctor. And then if you have family and young kids and all of that great stuff. So the same with in the north, where you may have to actually get on a plane with your family to go and
Yeah.
treat that. So the idea behind this project was and it's a fantastic plan. It has nothing to do with psychology, but it's just basic healthcare, a supplement to their healthcare. Is you can get on your phone and talk to a nurse practitioner and perhaps have a prescription. You can be diagnosed, prescribed, and the prescription in the mail to you tomorrow for whatever itch that ails you that day. So it alleviates again some of those stressors of being in smaller spots or being in a new division or a new province and not having access to care. Um, and then the lobbying side of the house now is to ultimately get the government to agree to pay for some of these things because we've shown that they've been successful and they've had an impact on morale, retention, recruitment, and such. So we'll probably do that in our next round of bargaining because we're just coming up with some results. But provincially and federally, we've lobbied to the Minister of Heritage, for example, Did you not know that um, Canadian flags and RCMP detachments are not lowered to half-mast when a police officer from a different police agency is killed in the line of duty?
Oh, no.
And that's a stupid piece of legislation that needs to be modified. It's one little article that would allow, right, federal government buildings or RCMP detachments to lower their flag at half-mast if a member of the BPD is killed in the line of duty. The converse, they already do, right? When um, any member of ours dies in the line of duty, you always see other detachments, whether it's the OPP, Toronto, Edmonton, right, lower at
Yeah.
half-mast out of respect. So we're trying to do that, little things that have an impact, and it's just those organizational stressors. And I look at it as the member of the RCMP has three kind of employers, right? There's everyday Canadian, there's the RCMP, and then there's the government of Canada. That kind of sets the rules. So managing that balance, we've got great confidence with the everyday Canadian. I think there are some challenges with the everyday member and confidence in, or shouldn't say confidence in, trust in RCMP management,
Yeah.
that they have their best um, um, at heart, right? Whether it's a decision about healthcare, whether it's a decision about a new pistol or the color of a shirt or uniform, things take time with them, and sometimes we scratch our heads saying, "How did they come up with that decision?"
Yeah.
So as we get better, still a new union advocating for and getting more resources on the ground so there's a better work-life balance. We can also at the same time figure out how we can get better healthcare supports, mental health supports, all sorts of things through all of those different avenues, whether it be RCMP management or different levels of government.
Yeah. Well, but do you
Yeah.
find when you're doing this lobbying, so if you're talking from uh, government types to, I mean, you were saying you go down to some rural groups,
Yep.
urban groups, like you're talking at all kinds of levels. Do you find that people generally understand this mental health side of things? Like I find it hard when I'm trying to tell people about my job, and I'll just tell them like some crazy call I was on, and you can tell just when you're telling them, they're like, "Oh, wow, that sounds insane." But it's like, but do you really get it? Like, I could never use the words to describe it enough to maybe impress upon you what the actual experience is like, right? Uh, so when you're doing the mental health talk to people, do you find like, do they genuinely understand? Do you think they really get it, or is it just like, yeah, that sounds bad. Here you go. Like, I'll approve this or give you some money. Like, how in tune are they? I guess is kind of my question.
Well, two things, if we're doing work at a local level, like a municipalities association, for example, normally what we're not talking about broader policy perspectives there about like mental health benefits for members to serve their communities. We might have a paper there for them to read or a booklet for them to take home about the state of the union. But they're not a decision-making body. They can advocate on our members' behalf because those members serve in their communities. Usually, we're there to gather intel. What are their concerns with the service delivery in their municipality? Talk about any specific initiatives that are ongoing. Are there resource challenges, staffing challenges? What would they like to see for a better, more effective functioning RCMP? And at the same time, then we'll take that to the respective minister, whether it's in New Brunswick or Nova Scotia or Saskatchewan. For example, in Saskatchewan 2 weeks ago, a lot of what we heard was challenges with resource levels or stealing from one detachment to cover the other. And then we went and met with the minister, and obviously the budget had already gone in, but he promised added funding for added resources to supplement the Saskatchewan RCMP. So a lot of stuff that comes from the grassroots level. Now, if we're talking global policy pieces like the recommendations here, I think they get it. And it depends on the person, right? So, Minister
Mm.
LeBlanc, for example, or the Minister of Mental Health and Addictions federally, Minister LeBlanc has grown up with the RCMP, serving his community. He's got a deep-rooted respect for how we police, where we police in New Brunswick and such. So I think he's got a very good understanding of that, and he supports the membership globally. So how can he implement policy changes that has a positive impact? And no one is out to stab anybody in the back here. I think everybody wants the same thing: safe communities, safe members, good organization, and such. The challenge, obviously, today is fiscal restraint and all that great stuff. Hence, why almost all our recommendations have no money attached to them. And then you go to Alberta. Minister Ellis, does he get it? Probably. Having been a police officer, would he understand and grasp the importance of a program such as PSPNet, for example, to be open to Alberta sheriffs as well as Edmonton Police and Calgary? So he would. Now, would they be willing to sign a check to support that? That's a completely other discussion, and we would have to make the case to them to advocate for that. So.
Okay. Just as we're coming up to the end of our time, I want to kind of end on some solutions. So, with all the info we have right now, and 2 studies, the longitudinal's obviously still going, but where are we at with solutions? What is available to the membership? And I don't know, is there any wishes for the future?
Lots of solutions out there. I know, as I mentioned, just talking with the minister a week and a half ago, he's interested in solving problems. And I met with the commissioner last week, again, interested. And I'm fully aware that there are filters at play here, so even in my own organization, I don't hear about everything that happens on the ground. And sometimes I get a filtered version of what happened through different levels. So one of the good things about having the commissioner in attendance at the breakfast and being able to say, here's your book, is he can sit back and read it, and he can say to his direct reports, make this happen.
Yeah.
So we have been making a lot of traction. I've met with a number of the health networks, private partners across the country, and it's just from our perspective, we mentioned Edgewood Health Network in the paper, but it really doesn't have to be Edgewood. Could be Bellwood, could be Norwood, could be any of the woods. But basically having that easy access to care. One of the leading things that the RCMP is doing, which I think is great, is the psychological personal health assessment, which is starting at 3 years. Every member now has to have a checkup from the neck up with a registered psychologist. So the RCMP decided let's hire our own.
Okay.
And they found over the last 18 months, they can't find enough to actually do it for everybody. Okay, well, we have benefits, just like every cop, you've got a best suite of benefits where you can go and see a psychologist. Well, why can't we use one of those psychologists?
Yeah.
They're
Yeah.
just as good to go and sit with them for half an hour once a year or once every 3 years. So those are some of the recommendations we've made. And it's simple, commonsensical solutions that you hope can be implemented. So I think there's a lot of light at the end of the tunnel. Cautiously optimistic. It's not a train coming the other way. But we're making progress. I mean, all you have to look at is the last decade, how the Canadian public and police and emergency services personnel in particular have moved the needle on stigma.
Yeah, there's been a massive shift.
Right? So we can continue with some momentum there, and hopefully another 3 to 5 years down the road, we'll be in a much better place.
Well, and just before you jump in, Nick, I'll say just for Brian and one of your members, Mark Bouchard. So he's got his book there, Setting My Sights on Stigma. I know he's doing a lot to change minds, and his book's been getting picked up in the US too with a lot of organizations. Like, you have a lot of members doing some really good things in there. So definitely a lot of light at the end of the tunnel.
I agree with Brian. I think we've got solutions. I hope the RCMP chooses to leverage the solutions that they themselves are building. I think we need to stick with evidence-based solutions and evidence-informed solutions to make sure that whatever we're doing is going to have the maximum possible positive benefits for all of our RCMP across the country. There's lots of There's lots of stuff being proffered everywhere across the country. We want to make sure we stick with stuff that works. And I think the RCMP is well positioned to do that, and so is the NPF. So I would really like to see them leveraging a lot of the tools and the training systems that they've built into the RCMP longitudinal study and finding ways to make those available to all of our RCMP across the country. But even that is one component of a solution, right? You need
Yeah.
a multi-pronged solution to deal with a multi-pronged problem, and so that's only one piece. And I'm looking forward to watching all of the benefits that come out of the work from the NPF and the RCMP, collaborating with our governments and our researchers and our clinicians to make things better for everybody who's serving.
Great. Well, we're just at the end of our time. I'll remind people just to go on the NPF website. You can download the report and see the results. It's not a heavy data report. It's not like you're studying for a test. It's 24 or 26 pages. Got some pictures in there and stuff, so I can read it. And also follow along with CIPSRT, doing some amazing work. And I would encourage people to check out some of these solutions. So I'll get the links up for both of those. And I'll remind people, follow along, like, and comment on the things that the Quiet Professional shares. We're just trying to spread some messages and get help out there for everybody. So yeah, thank you guys.
Thank you.
Thank you, Nathan.